NewmanCam, Cost-Benefit Analysis with Chris Newman. In this tutorial, Chris Newman will discuss the importance of doing cost-benefit analysis within your academic research.
One of the things which my students frequently do in their first draft, when they're talking about a solution to the problem that is the basis of their first draft, is to say that they feel something or they believe something. I don't care. The way you show with evidence that your solution is preferable is with something called a cost-benefit analysis. In a cost-benefit analysis, you take the costs and the benefits of one alternative, stick them alongside the costs and benefits of the other alternative, and allow the reader to see plainly that your alternative is preferable. We're going to use pneumonia shots to illustrate this process. Now, this is a problem that faced me about 3 weeks ago, 4 weeks given the day. I was doing my once every few months visit to the doctor to make sure the medicine he's given me for my cholesterol isn't killing me. And he suggested that I get a pneumonia shot. I said, Ed, I've already had my flu shot. I said, no, pneumonia shot. So I had to decide whether or not to get a pneumonia shot, and I had some outcomes from the shot which were undesirable. But let's use getting a pneumonia vaccine shot as an example for a cost-benefit analysis. Should I get a pneumonia shot? Because I know there are side effects. So you do some research, looking at scholarly articles to see what happens that's bad if you get a shot and what happens that's bad if you don't get a shot and happen to catch pneumonia. And we go to the official CDC website dealing with pneumonia statistics, and we scroll down to the most significant downside of catching pneumonia: mortality. I love these commercials on the television that say, if you have died, you may sue the manufacturer of the drug. I find, according to the Center for Disease Control, that you have in excess of 52,000 people a year who catch pneumonia who still die. It was much higher back in the days before the development of antibiotics. And I find that this is a rate of 17.3 per 100,000 population. And then, since the more facts the better in an academic presentation, I seek confirmation of the CDC concept by going to a site maintained by the Immunization Alliance, and I see how serious pneumonia is, and it shows me that there are lots and lots of people who die as a result of this, as is being displayed on your slide you're looking at now. So, big death rate possibility if I don't get the shot. Death, bad. So we know the downside to pneumonia, real good possibility of being dead. What are the downsides to getting the inoculation or the shot? I know there are some side effects, and that's actually what happened when I did this. My left arm swelled up considerable for a couple of 3 days. But I go to the official website of the Immunization Alliance, and I see item number 6. What are the risks from the shot? About half the people have mild side effects such as redness or pain. Less than 1% develop fever, muscle aches, that's me, or severe local reactions, that's not me. So, in favor of getting the shot, you don't get pneumonia, you don't have that good chance of dying. Opposed to getting the shot, you may get a sore arm that's red. So notice what we've done. Without recourse to what I believe and for sure to what I feel, we have lined up the benefits and the costs of getting the shot for pneumonia. The benefits are you don't catch pneumonia, you don't die. The cost, you get a swollen arm as an unlikely outcome. And you say, given the huge benefit versus the minor cost, it's obvious that you get the shot. See, notice I've managed to arrive at the conclusion I wanted to arrive at without having to tell you about my feelings, sharing my feelings with you. That's how you should deal with an issue and question of fact in an academic paper. I don't care what you feel. Prove it to me with numbers.